in. Hi, Sally. How are you? My name's Tanya. I'm going to be your nurse today. How are you getting settled in here to the postpartum area? Good. Awesome. Your baby's adorable. Well, I'm here to do a assessment on you, make sure everything is looking okay and that you're healing nicely. Is that okay? All right. Perfect. If you wouldn't mind stating your name and date of birth. Okay, perfect. That matches. All right, I'm just going to start with some simple vitals, and then we're going to check your breasts, your uterus, your perineum, and your legs. Okay, I'll ask you a few questions along the way. All right, we'll go ahead and get started. I love your hair color, by the way. It's gorgeous. All right, 98.7, perfect. All right, I'm gonna listen to your lungs and your heart. You can go ahead and just breathe normally for me. Okay, your lungs sound good, nice and clear. Now listen to your heart. Excellent. No murmurs. Nothing to be concerned about there. Sounds good. All right, I'm going to go ahead and do your respirations and your pulse. Okay, respirations are 65 and your pulse is 15. All right, so next I'm going to examine your breasts. I'm going to have to pull down the sheet and pull your gown up. Are you okay with that? All right, perfect. Are you breastfeeding or are you bottle feeding? You're breastfeeding? Wonderful. How's that going so far? Baby latching on pretty good? Good. Have you noticed any, has your colostrum, have you noticed any colostrum? You have? Okay. Yeah, your milk should be coming in the next day or two. So I'm just going to check your breasts. I'm going to pull your sheet down here, pull your gown up. Okay, let me know if you feel any tenderness, okay? How's that feel? Any pain, discomfort? No? Okay. All right, well, there's no redness. Your breasts feel firm. Your nipple's flat right now, which is okay. Is it able to be stimulated pretty well when baby latches on? Yeah? Okay, good. All right, now I'm just going to check your fundus. When's the last time you went potty? About 30 minutes ago? Excellent. And when you did that, did you change your pad also? Okay, good. Was there a lot of blood on the pad when you changed it, or? Okay. Oh, but you changed it about 4 hours prior, so it'd been there for a while. Okay, perfect. All right, well, I'm just going to check your fundus. Let me know, and your uterus. Let me know if there's any tenderness here when I palpate. Anything at all? Any pain, discomfort? A little tender? Okay. All right. Okay, you're going to feel me. I'm going to try to get your fundal height here. All right. And the reason I asked you if you'd used the restroom and urinated was because a lot of times if you haven't urinated, your bladder can go up into your abdomen and over to one side or the other, which can then cause your uterus to want to stop to contract. Okay, and there's the top of your fundus right there. So you're at about 1 centimeter below your umbilicus, which is very normal since you're about 1 day postpartum. Okay, and if you were to have had a incision from a C-section, this is when I would examine that as well, and I would look for any redness, edema, drainage, anything abnormal at all with that. Okay, all right. And have you had a bowel movement since you've given birth? You did. Okay, this morning? Excellent. And how was that? Did it hurt? Any discomfort along with that? No? Okay. All right. Good. And I saw that you had an episiotomy, so I'm going to look at that here in a moment. First, I'm going to look at the lochia on your pad, okay? And you said you changed that about 30 minutes ago? Okay. All right. Let's just take a look here. Okay. Good. There's about 3 inches. It's red, but not a whole lot of drainage. I'm gonna roll you over. I'm gonna have you throw that left leg over so I can take a look at your perineum. I want to make sure there's no pooling of blood underneath of you, as well as check that incision. Make sure there's no hemorrhoids. Do you have any history of hemorrhoids at all? No? Okay. All right. Excellent. Well, I'm just gonna turn you over here. Okay. Perineum looks good. Incision looks great. No real redness, a little swelling. Have you been using ice packs on that? You have? Okay. Do you want me to get you a fresh ice pack when we're finished here? Yeah, it does feel good, doesn't it? Okay, good. All right, so that all looks normal. I didn't see any pooling of blood. I'm going to check your legs. I'm going to just feel here. Let me know if there's any tenderness along here. I don't feel any warmth. That's good. Any tenderness or pain when I'm pushing? No? Okay. Looks like you have a little edema, but I looked in your chart and you were pretty edematous before, so you'll notice you'll probably do a lot of sweating and probably a lot of urinating, getting rid of all of that excess liquid. All right, I'm also going to check your pedal pulse. Make sure I feel that down here. And I do. I would normally remove your socks. However, your sock is stuffed with socks, so I don't want to do that. Okay, so that's all good also. So everything is looking really, really good. I want you to make sure and let us know if you have any excess bleeding, okay? So if you soak a pad within an hour, that's not normal, so I want you to let us know about that right away. Also, if you have any clots, I didn't see any clots in your pad, but any clots larger than a plum would be of concern, and you'd want to let us know about that. Any pain in your legs, you'd also want to let us know about that. So yeah, any questions? I'll go ahead and get that ice pack for you. How's everything else going with baby? You doing okay? Getting some rest at all? Yeah? And you have help? Good. Okay, well, if you need any extra rest while you're here, you let me know. And I'll check on you guys soon. I'm going to check on your uterus about every 4 hours. I want to make sure that its night remains firm. It feels really good right now, but I want to make sure that it remains that way because we want that uterus to continue to contract and invert back into your pelvis. So, okay, any questions for me? All right, excellent. Get some rest. Enjoy that babe. Talk to you later.